Hi, everyone. Okay, so to get started, the World Health Organization defines health as a state of complete physical, mental, and social well-being, and it's not just merely an absence of disease and infirmity. And the Healthy Communities approach considers all of these factors, so social, economic, environmental, and physical factors that influence the health and well-being of a community. The main contributing factors for how healthy you are actually the social situations and the physical environment in which you live. So these are things like race and gender, your early childhood development, your income, working conditions, that type of thing. Health inequity is the differences in health outcomes that are avoidable, unfair, and systematically related to social inequality and marginalization. And planning can have an impact to reduce health inequity. So the BC government, Provincial Health Services Authority, they completed a review of population health research and came up with some planning principles which have demonstrated have positive impacts on the health outcomes of a population. And this document is called the Healthy Built Environment Linkages Toolkit. So when you look at planning, there's a ripple effect which links planning to health. So planning policies such as the OCP, zoning, that type of thing, they influence the patterns that are in an urban environment. That means how far you have to go to travel, your transportation options, your access to school and work. Those influence your individual behaviors, the amount of walking that you do, that type of thing, and that has an impact on the population. So what are the things that we should do? Well, we shouldn't do this type of thing. So we want to have your population close to your core so that residential areas are close to schools, work, and the daily things that you need, and you have lower in municipal infrastructure costs. So instead of having that sprawl, what we want instead are compact mixed land uses which are compatible with each other. So you want residential, commercial areas close together. You want those areas close to parks. And this is more of a picture of what we want. Healthy neighborhoods also have complete features. So we want all the amenities a person needs on a mostly daily basis. So your work, your school, grocery stores, banks, doctor, your recreation, we want them close together and within your community or your neighborhood. We also want your neighborhood to be connected, to be well connected. So grid patterns are better than cul-de-sacs because you have a more direct route to get from one place to another. You also want pedestrian and bicycle routes to be connected to each other as well as to daily destinations. And you want the transit system to meet the needs of the community and where they want to go. You also want healthy neighborhoods to support social connection. You want places where people can gather, they can talk to each other, and get to know each other, and this has a positive impact on mental health. When we look at the transportation network, it allows convenient, safe travel by walking and cycling and other active means of getting around. So you notice in this picture, the pedestrians, cyclists, and the vehicles all have efficient, safe ways to get around their community. This is a picture from Vancouver. These routes must also be interesting and aesthetically pleasing. Now, when you think about the healthy natural environment of a community, we're looking at preserving and connecting open spaces and environmentally sensitive areas. We want expanding natural elements across the landscape, and we want to improve, maximize the opportunity for people, for everyone in the community to access and engage with the natural environment. And this has been shown to have a positive effect on the mental health of a group of people or a population. Now, especially today, talking about it on the news all day, is housing. And housing has a significant effect on the health of the people. And so we need to ensure that diverse housing forms and tenure types are available to support access to affordable housing. We need adequate quality of housing. We need the housing to be located in locations where it minimizes exposure to environmental hazards such as wildfire interfaces, for example. And we need to meet the needs of priority populations. Now, priority populations are people who are homeless or have low income, children, elderly, people with chronic illnesses or disabilities, Indigenous populations, and newcomers to Canada. So when we're planning, we need to put ourselves in their shoes to see how they could experience the community. When you wrap all this together, what happens is the population each individual person has better behavior, and they end up having a healthier choices available, and research has shown that people will actually have more walking and are more physically active. But it's more than just young adults, for the most part, going to the gym and working really hard and doing a workout. What we want is more people, everybody in a community, to choose to be active in their day-to-day lives, in their routines, and choose healthy foods and healthy activities and be less sedentary. It also means that people are more connected and they have less social isolation, which increases mental health. More people are talking to each other. So when you wrap all of these features together, what ends up happening is they end up having decreased body mass index, decreased rates of obesity, premature death, unintentional injury, and overall stress. And this results in decreased rates of diabetes, stroke, high blood pressure, asthma, some cancers at a population level. And in addition to this, it also increases rates of people reporting having good mental health. There's less anxiety, depression, and mood disorders. And generally, people have an overall better sense of well-being. And that's the end. Thank you.